An amateur bodybuilder has told how steroid use wiped out his fertility and put him on course for a heart attack as a new documentary warns that the drugs are Glasgow's hidden public health crisis. Darren, a 35-year-old sales executive, has been injecting anabolic steroids on and off since around 2004 to improve his physique. The Class C drugs are legal for personal use, but much of the supply comes from unregulated, underground production lines, meaning there is no guarantee that they are safe. Laboratory testing revealed that the actual testosterone concentration in the type Darren had been using was much higher than labeled, meaning he was unintentionally overdosing. Health checks also found that his testosterone levels were so high they could not be measured, his resting heart rate was twice what it should be, and that despite an otherwise healthy lifestyle he was at massive risk of a sudden heart attack, so high, in fact, that medics estimated his lifetime risk was 100%. I knew there were going to be issues, but I didn't really expect it was going to come back saying I had a 100% lifetime chance of a heart attack, said Darren. He is among the participants in a new BBC Scotland series, Laid Bare, which puts volunteers through a sort of living autopsy to predict what might kill them unless they change their habits. Darren's case comes amid alarm over the rise in steroid use among gym-goers, which has been blamed on a Love Island effect as men feel increasingly under pressure to achieve a muscular body. In July, England's local government authority, the umbrella body for councils, said the problem was an emerging epidemic, with some council-run needle exchanges reporting that 40 to 60% of clients were injecting performance and image-enhancing drugs, IPTs. As well as steroids, some users are injecting synthetic tanning hormones. John Campbell, who runs NHS Greater Glasgow and Clyde's needle exchange outlets, said he set up the city's first typed clinic a decade ago after noticing a real increase in the number of people injecting steroids. He said, "The reality is we have 8,000 steroid and image-enhancing drug injectors in Glasgow, and that would take it up certainly to the level of our heroin injecting population, if not above that. Injection also carries the risk of muscle abscesses if the product has been contaminated with bacteria during production in unregulated labs." Darren, who lives in West Lothian, said he noticed no ill effects until he and his partner began trying to conceive around 5 years ago. "I was basically infertile for a while," he said. "My partner and I were trying for a baby and it just wasn't happening. I had a feeling I knew what was wrong, so I had my sperm count tested. When it came back it wasn't 0, but it was going to be pretty much I. For more on this story, visit the news article link.